Scotty's doing 7 presentations.
Who does?
That's before we even do the reports. Lloyd.
Good luck.
We're doing a special system.
I'll remind everybody that we're working toward a 3:30 deadline. Okay? In view of the fact that we have quorum, I would like to call the meeting of the Board of Health to order. And reminder once again, we are working to the 3:30 timeline for the Police Services Board. So the sooner we start, the better, and that is now. Members of the public are advised that our meetings are webcast live by the City of Hamilton and temporarily archived on the city's website. Other individuals and the media may also be audibly and or visually recording this meeting. Also wish to advise committee members that if they feel any items on this agenda are time sensitive, Council will be requested to waive the 48-hour rule tomorrow night in order for the board to present its report from this meeting. Seconded. That's not a motion. Carried, okay. All right. Collins, Merulla, all in favor? All right. So that means we'll be able to waive and have the committee report dealt with by council. Madam Clerk, are there any changes to the agenda?
There are no changes to the agenda, although there will be an amending motion to item 9.1.
Okay. A motion, please, to approve the agenda as presented. Councillor Johnson, Councillor Powers, all in favor? Thank you. Any declarations of interest? Hearing none, I need approval of a motion for the approval of the minutes of March 17th. Councillor Ferguson, Partridge, all in favor? Carried. Thank you. No delegation requests today and no consent items. So we go to discussion items, and item 8.1, Physician Recruitment Specialist Employment Contract. Is there any discussion? Councillor Ferguson.
Yes, this was a report that was requested by a member of council to go back with some comparators. So Janie's here to answer any questions, but at the appropriate time, if you come back to me, I'll move Jane's contract. That is, I think, 12.1 in the confidential section, unless someone wants to go in camera to talk about the specifics.
Okay, so a motion to receive the report. Councillor Ferguson, Councillor Powers, all in favor? Carried. Thank you. The Physician Recruitment and Retention Steering Committee report was tabled at the board meeting.
Mr. Chairman, I would like to move Jane's contract at this time, though. Since there's no questions on the discussion item. Her contract is 12.1. There's no need to go in camera if we can just approve it now. So I've moved that.
Seconded by Councillor Whitehead. All in favor? You want to speak to that?
Question. I'm looking at the expiration date. Is that correct on the 12.1? Item number 1?
Looking for Janie. Is she, oh, there she is.
So what's the issue once again? Is the expiration?
On item 1 it's I'm not sure what the effective date is, because in the contract it indicates that it's already expired. 22nd day of November 2013.
It does look like a typo, because it's effective on March 2011, and it says effect 2013. I suspect that should say 2016. But through you, maybe Janie, is that correct? It's on 12.1 in the preamble, or Jane Walker sitting behind you. She could also fill you in.
Okay, that's when it expires. This 2016.
Could you pull the mic toward you?
It expires 2016.
Yeah. So thank you, Councillor Clark, for picking up on that.
Oh, I'm assuming that needs to be amended then.
As amended. Yes, sir.
So an amending motion to correct the date, Ferguson, Powers, all in favor, that the date be changed. And
in
any
Schedule
discussion beyond that?
And in Schedule A, it's also incorrect dated there.
So wherever on the document that incorrect date appears by the previous motion, there will be amending to correct the dates. Okay? It's funny what you miss. Must have looked at that 5 times and didn't see that.
I did too, and of course it shows effective date 23rd, 2010, which is the date of the former contract. So we haven't changed the dates, both start and finish for the new ones, because we, of course, used the old contract to make the changes. We forgot to change those dates. So the effective date is March 2013, and the completion date is 2016, November 2016.
Okay, so that's moved and seconded for the amendment. All in favor? Ken? Carried. Thank you. So that's it for that item. And let me see. We have item 8.3 now. The Ephinephrine Auto-injector Pilot Project update.
What about 8.2, Mr. Chair? We haven't done.
Did I miss it?
Yeah.
Okay, sorry. The Physician Recruitment and Retention Steering Committee report was tabled. We need a motion to lift the item. Moved, seconded, Powers, all in favor. Carried. It's now lifted. Members of the board, if you have a specific in-depth question regarding the contract that we must move into closed session.
We've done that part.
Right.
Yeah, it's the next part. We're now on to the 8.2, the physician recruitment report.
Oh, okay, so.
And Mr. Mayor, it was requested at the last board health meeting that we bring forward the KPIs for 2013, and they're now before you, which shows that Jane was successful in recruiting 24 new recruits, of which 19 are permanent, bringing the grand total since the start of the program to 189 new recruits that we've brought in. We are now up to 367 family doctors, which is an improvement, but we still got problems in the age where 60-64, there are 49 doctors practicing, 65 to 69, 21, and 70 and over, 19. And so we still got some work to do, but we've made a significant improvement. When I first took over this committee, we were short about 40 physicians. We're now down to under 25 that the city is short, using the 1,380 patients per family doc. So those are the KPIs that are before you.
All right. And any further comment on the report? Move to receive, Councillor Whitehead, seconded by Councillor Partridge. All in favor? I'm sorry, I'm being waved at.
Mayor, we will take the amendments that were just put forward on the contract because this resolution is specific to the contract.
Yes.
For approval. So we will take those amendments that we've just approved and include them with the report going forward to council.
Say that again.
Sorry, Mr. Mayor, when you entertain the amendment to the contract just previously, those amendments are actually specifically related to the contract renewal that appears in item 8.2. So we will take those amendments for the dates and include them with this resolution going forward to council.
And including the contract will be amended to those new dates also.
Correct.
So the resolutions are in order?
So item 1 is approved as amended.
Right. Item 1, approved as amended.
Correct.
By Councillor Whitehead, seconded by Councillor Ferguson. All in favor? Carried. Carried. Thank you. Just then, is that some kind of Sudoku game you're playing there? Or yeah, loser. Okay. Order, please. Order. Item 8.3. The EpiPen project update. Who would like to speak to that? Councillor Ferguson?
Well, I'll move the recommendation to get on the table, and then I'd like to speak to it.
It's moved and seconded. So the recommendation is now on the table. Is there any discussion regarding item 8.3?
Yes, Mr. Chairman, I did just some brief comments. Of course, this started last May when we brought a resolution before Board of Health in Quebec in October with a report from Dr. Richardson and her staff to move forward with the pilot project, and this is driven because we're seeing about an 18% increase annually in the amount of allergies, food allergies that our society is seeing. And this all became a reality last March when young Mia Gallo lost her life in Mapleview Mall when she ate an ice cream cone unaware that she had an allergy. And so I was approached by the Rotary Club of Ancaster to be a political champion on this, to try to get EpiPens into every food establishment in the city of Hamilton. And so last November, Dr. Richardson and her staff came back and said that she would need until the spring of this year to work with Dr. Washington at McMaster University to put together terms of reference, get approval from physicians and surgeons, college physicians and surgeons, and put together a plan for training and implementation. That's now been completed. And so the resolution before us today is to go forward with the pilot project. And I just want to thank a lot of people who, typically this has received a lot of North American media, certainly across Canada, that Hamilton is leading on this issue. And during the past several months, I've had the opportunity to work with Dr. Trant and Brent Browett, who never once said it can't be done. They said it's how we're going to get it done. And I very much appreciate that. And, typically you get into issues with legal and these sort of things, but Janice Awad-Patowski was, laid out the risk. It's in her report, but it said it's very minuscule and it's something that we can support. I would also like to recognize Susan Washington, who's in the audience with us today. You may just wave, Susan, say, see you are. She's from McMaster University and worked very close with our Board of Health to put together this pilot, and is a very well recognized expert on allergies. And Lori Harada is also here, who is with Anaphylaxis Canada. You can just wave your hand. And the person that spearheaded it from the Ancaster Rotary Club is Marty Scher, who's also in the audience with us today. By the way, Marty won 2 weeks ago, as you know, Mr. Mayor, Citizen of the Year in Ancaster. So congratulations also, not only on this project, Marty, but on your service to the community of Ancaster. And I understand that Leah Gallo said she was going to be here. I don't see her in the audience yet. She was had a class that she had to finish up, but she's Mia's mother, who we've been working with, and she's also very supportive of this. She lives in Stony Creek, and she'll be wandering in shortly because she had to finish a class. I told her we probably wouldn't get right to it by 1:30, but we made good time today and got ahead of her, but she's also very much supportive of it. And lastly, I want to thank two malls, Jackson Square and Eastgate Mall, who stepped up to the plate and says, why wouldn't we support this? And so we will, if this resolution carries today, we'll be piloting in those two malls, and it's the security staff that'll be training. So we're not having to train every restaurant, it just be the security staff, and they'll keep the epinephrine auto-injectors in their toolbox, if you will, so that they can use it if required. So I'd just like to thank all the staff, amazing job, and the community, McMaster University, and to the Gallo family for being very supportive of this. Thank you.
Any further comments? Councillor Collins.
Mr. Mayor, I just want to take this opportunity to thank Councillor Ferguson. I think we've all watched with great interest and awe in terms of the amount of time and energy that he's put into this effort. And from time to time, we all pick up issues that are important to the community, and certainly Councillor Ferguson's been a real leader on this issue, so I wanted to publicly thank him for his efforts as well.
Thank you. Councillor Duval.
Thanks, Mr. Mayor, and I also appreciate the report in front of us, and I certainly support it. The question, though, is to our staff is I understand the local malls in the city of Hamilton were approached by representatives of McMaster University and the Ancaster Rotary Centre. No problem with that. But the malls that they picked, Eastgate and Jackson, was Lime Ridge Mall at all asked or requested?
Please speak into the microphone. Marty Scher, welcome. Lean right up to that mic.
Thank you. I had approached Lime Ridge Mall probably 4 months ago, 5 months ago. They were the first mall that I had approached, and they decided sometime in March that it wasn't in their best interest at this time to engage in the project. I would expect to be hearing from them now that two of their major competitors are in the newspaper.
Okay.
But my question is, what is your feeling on Lime Ridge Mall? Why did you mention Lime Ridge?
Well, Lime Ridge Mall is in my ward, and I know it's a big mall, and they have a lot of eating facilities in there. So I'm just, you know, these are two great malls also, and I certainly think this is a great idea. But with Lime Ridge being in the center of up the mountain.
Well, I'm going to be contacting Cadillac in Toronto, and might be this week, maybe next week. I'll let you know what their response is at that time.
Okay, that'd be great. Thanks very much, Mr.
Okay, Councillor Whitehead.
Can I ask if Westcliff Mall was approached at all? Westcliff Mall, were they approached at all?
The only malls approached were Lime Ridge, Jackson Square, and Eastgate.
Is there a reason for that? Is there a reason for that?
They're probably the three major malls in Hamilton.
Sorry?
They're probably the three major malls in Hamilton.
They are. No, I'm not questioning that. So we just want to reach out to the largest malls.
Well, we look for malls that have the demographic that covers a broad base. And actually, Jackson Square is probably the most opportune mall. And they're working with the food service operators as well.
Okay.
And their security force is also trained in anaphylaxis, where the other security forces are not. They have to be trained.
And this is a more of a introductory, and there'll be an opportunity to expand on it depending on the assessment of the program. Is that correct?
Yep.
So there are other possibilities with other malls as we move forward. Is that correct?
Well, this is a project that other regions are going to want to get involved with, not
Great.
just the city of Hamilton.
Thank you.
Okay.
Councillor Ferguson, did you wish to speak
Yeah, just a
again?
couple things. Yeah, this is weird. I think we're all a little disappointed Lime Ridge didn't agree to join. I'm not sure we got to the decision maker in Lime Ridge. So, Councillor Ball, if you've got contacts in there, I think it'd be great to have three malls. We don't really want to go beyond that because it is a pilot, and I see Dr. Tran nodding at that. And so we can get Lime Ridge Mall inside. That would be great. But certainly Jackson Square and Eastgate have stepped up. And as I say, it is a pilot.
Okay, Councillor Pearson, did you wish to
Yes,
speak?
Mr. Mayor, thank you. I too want to commend Councillor Ferguson for carrying this forward in the Rotary Club. And, my question was also with regards to Lime Ridge, but I believe that if this moving forward today, this is a terrific initiative. And I think that more malls and food restaurants will probably, if it can be publicized in such a way that this is a benefit and a bonus to their facilities to have this in place, that it becomes similar to our food card, pass cards of restaurants, et cetera. It becomes a selling feature for their own businesses. And I think this is great, and it's certainly a tremendous comfort level that can be provided to our residents out there that may not, as Councillor Ferguson says, know that they have an allergy and be in a situation that that young lady was last year. Thank you.
Thank you. Councillor Whitehead, would you take the chair, please? To staff, the Part B of the recommendation says that authority be given to negotiate understandings acceptable to the city solicitor, the undertaking of components of the project with McMaster University, Anaphylaxis Canada, or other agents identified, and if acceptable agreements cannot be reached, Hamilton Public Health Services itself will conduct the necessary work or report back. So has a satisfactory agreement been reached with McMaster?
You, Mr. Mayor, at the moment, no, but we are in discussions with McMaster.
And what's the reason that McMaster hasn't signed on yet?
Well, so this is going through both a research and ethics process, and McMaster obviously has a lot of experience looking at previous types of research protocols. This is a little bit of a more unique research than other clinical trials, such as pharmaceutical trials. So they're just taking a little bit more extra time to understand the nuances before they approve it.
Well, through the chair, my understanding is that they are not willing to accept the risk. Is that part of their delay, that they will not or do not want to accept the risk portion of this?
Through you, Mr. Mayor. I haven't had direct contact with their legal department, but certainly one of the areas they would need to consider is both the legal and risk implications, which is, with due process, you have to take your time to make those considerations.
Mr. Mayor, I believe there's somebody else coming down from public health who may be able to address that. Go ahead.
I'll just shed a little bit of light. This is a unique protocol. I don't think McMaster has ever embarked on anything that takes place in the community using a protocol with this. It's quite groundbreaking and precedent setting. They are on board. They're working out the agreement. And at this point, I think it's just a matter of time before they do go through all the risks and how we're going to manage that. So they are on board, and I think that they will be players here, and I don't doubt that the outcome will be positive. We've been in discussions with them throughout. I just think that because it's a novel type of protocol, that it is taking a bit longer than usual.
Well, then my recommendation would be through the chair that we wait until that agreement has been reached, because there is risk. This is not zero risk. There's risk to this. And the risk that I'm concerned about is that we're running a project that will be handled by a third party. And third party actions may result in some unfortunate event that could lead to litigation, to a lawsuit. And if the lawyer looks at the responsibilities of the project, the City of Hamilton will appear as the main party to the litigation. And it will probably be, if something does on the risk, which is very low, it's in the ones and the points, and it's low, but it would be, judging by my review of other incidences of lawsuits, that it would be like $1 million lawsuit or something like that. And I'm only speaking on behalf of all the residents of the City of Hamilton, that we need to know if McMaster is willing to accept the risk with us. And so if it's still being worked out, then I would be happy to wait until their review is done and they're willing participants in all aspects of it. Because I'm concerned that someone else's legal advice is don't get into this, because there is a large risk. So, and it's unfortunate because the Rotary Club of Ancaster has come forward with a wonderful program. And to have the access to the EpiPens in as many places as possible is important. Excuse me. This is important.
Order, please.
This is a great project, and the Rotary Club is to be commended for bringing this project forward. Can the project be done with the assistance of the City of Hamilton without the legal binding to every outcome of the project? Because Rotary clubs all over the world do great projects that don't necessarily call upon municipalities to make them effective. And I don't want to discourage the Rotary Club of Ancaster. I don't want any opportunity to place EpiPens in locations where they might be needed. But I'm not convinced, based on McMaster's reluctance on the risk side, to put the city in a similar position. So if the legal might comment on that for me, I would appreciate it.
There is a clause in the legal, in the report, in the confidential report, in respect to legal. Is that something we can discuss outside the camera?
Sorry,
Yes.
through the mayor, I missed the last part of that question.
I'm sorry?
Can you repeat the question?
I missed Councillor Whitehead's question.
Well, I'm just concerned that we're moving ahead today, and the resolution before us gives staff authority to negotiate the... Sorry?
Yeah, the question is that we have received legal advice from you on 12.2, and the questions from the mayor seem to be leading to that legal advice. So are you comfortable having that legal advice and that privilege waived, Mr. Chairman, or do we go in camera to hear further discussion on that matter?
That's exactly what I was alluding to. Thank you, Councillor Clark. Janice?
Thank you. I'm sorry. That's the part that I missed. And yes, that's exactly the point. I guess what I could say is, you know, the report on its face is set up in a way that, while the city leads, the opportunity is there to basically contract out under MOU or other agreements all the component parts. So that's the way that Dr. Richardson has set the report up. And in respect of the elements of risk, to the degree that they're completely explained in the confidential memo, my comfort level would be to go and close to discuss any of those particulars and what may or may not be the concerns, if any, from McMaster's legal services.
Well, thanks. We don't need to go to the legal aspects in camera yet, based on what I have before me. But what I do want to come back to is the fact that McMaster is uncertain about the risk side of this. And the CFRA, the Restaurant Association, met with us, and their preference is for a voluntary program, which I think reduces, in a sense, general aspects of the risk, because we have the Sabrina law and we have other indications that try to mitigate the risk of trying to help somebody who's struggling with a health problem in the public realm. But I think that we're still...
Excuse me, hang on. Show some respect. We have a speaker that has the floor, so everyone else can hear him speak. Thank you.
I'm trying to tread carefully with my words, because I don't want to put any obstacle in the way of what is an outstanding incentive to the community and to the members of council representing the city to enhance the safety and lives of people. But I just want to make sure that we have it right. And this resolution, we have the authority to negotiate. Any agreement has to come back for approval. And so what I'm saying is that I can support this as it's written on the understanding that if acceptable agreements cannot be reached, Hamilton Public Health Services itself will conduct the necessary work or report back. So through you, Mr. Chair, are we good with that today in terms of how this project is moving forward, that all of the I's will be dotted and the T's crossed before the formal commitment is made, also with an understanding of risk that may have to go into an in-camera meeting? Could I ask Dr. Richardson if that's a fair summation of where we are today with this? Because the media indications were that we're moving ahead with this today, and I still have concerns. So that's my question to you, Dr. Richardson.
Through you, Mr. Deputy Mayor, just to understand, the question is whether we're at the stage where we would move forward if we needed to? Yes, we're at that stage in terms of the work that we have done. Our preference would still be to contract out the work through McMaster and to work with Anaphylaxis Canada on this work. And I think in some way, shape, or form, that's what's going to happen moving forward. But at this point, what the report says, if that's unable to, in the unlikely event that all of that didn't happen, that we would then move forward with it.
Okay, thank you. Those are my questions.
Thank you. I do have Councillor Ferguson a second time, I believe, and I have Councillor Clark first time.
Thank you, Mr. Chairman. So when I'm looking at this report and I'm trying to understand the intentions, it would appear that McMaster, their main interest is research in this recommendation. Is that a fair statement? And I'm assuming the city's concern and the Rotary's concern and anaphylaxis concern is preventing accidents from occurring in the mall. So it's more of a public health prevention component. Is that correct, or are we also involved with the research?
Through you, Mr. Mayor, I think those are fair points in terms of I think the focus of McMaster is research, and the focus for public health is to prevent illness or any injuries. I think there is overlap because the research part is to help inform the best possible project to prevent any of these instances from happening. So I think we do need the research to get the data to design the best type of model out there to do that. And also talk to Dr. Wasserman that anytime if you have something that's sort of published and it's well done, it also gives a little bit more prominence so that it can be sort of shared and reviewed with others for the same reason.
So is there any dispute on the efficacy of the EpiPen?
Through you, Mr. Mayor, the actual research on the effectiveness of the EpiPen or Auto-injector or Ephinephrine Auto-injector isn't in question. We know that early administration of these devices for epinephrine, addresses the symptoms, can save lives if done early in the appropriate situation. It's just that it's just how you do that in an emergency setting in the right situation. Who do you give it to so that it's done in a timely manner that and target towards where people tend to have reactions or exposures that we need a bit more research on. The auto-injectors themselves are safe and effective, especially if they're administered appropriately.
And my understanding, reading the report, Mr. Chairman, is that the intention is that the security guards in the malls would be the ones that would be armed, for a better use of term, with the EpiPens?
Through you, Mr. Mayor, for the pilot, yes. That's the arrangement we have with the malls. Obviously, in moving forward with the pilot, we would explore other distribution systems, but this is the most, the first logical step for administration. They're there. It's rather than, I think we've had discussions before in terms of having it available to everyone, to all the public, to the food handlers. If you do it with security guards, the main benefit is you can focus your training. The access becomes a lot more centralized, and these are people who are trained and expected to respond to a number of issues. They're on site, so that's probably the most efficient way of addressing it. At least we're thinking, so that's where we're putting the pilot project in first phase.
And to our legal counsel then, is there legislation that indemnifies the third party from any wrongdoing if they use an auto-injector EpiPen incorrectly and someone dies?
So through the Mayor, the most relevant legislation we think is the Good Samaritan Act, which will provide coverage for everything up to gross negligence. So that is probably the most relevant piece of legislation which will provide that protection.
And just to define gross negligence, that would be intentional harm?
Yes, through the Mayor, virtually. I'm not sure that there's mens rea required for it, but certainly it's far beyond inadvertent negligence or that kind of thing.
And is the city then indemnified if we're a partner to this under the same legislation?
So through the Mayor, it constitutes a statutory defense to a claim as opposed to an indemnification. It's a statutory defense that can be raised if a claim is made.
So the statutory defense is just to minimize the claim? Financial claim?
The statutory defense may be effective to defeat any claim. In other words, it's a statutory defense against such a claim. It's sort of an immunity, if you will, against a claim.
Okay, my preference would obviously be to have McMaster signed on, but I can understand if the research side isn't. I mean, I've seen research projects take years just to get the ethics right in terms of how they're actually going to follow through, and that's not disparaging at all. It's just the nature of the beast in terms of dealing with research projects. I think in terms of the city's indemnification, I was more concerned with the security guards. They're going to be trained, and if Cadillac Fairview doesn't cover their back, what would happen if they incorrectly injected someone and there was a death? So if the Good Samaritan Act is what we're hearing from our city solicitor, covers them off in terms of that indemnification, except for gross negligence, and then we can use it as a statutory defense, there's really minimal risk to the city then. Is that my understanding? I'm not talking about the statistics of this happening. I'm talking about a legal defense against a claim.
Yes, through the mayor, that's generally correct.
Okay. I'm fine with it going forward, Mr. Mayor. I did have some concerns, but I think my questions have yeah, exactly.
Okay, any further comments? Councillor Ferguson.
Yeah, listen, I'd like to have every I dotted, every T crossed also, but this is a pilot. This is not launching it. Certainly we got some consultation to do with the Restaurant Association when we start to go to every food establishment across the city, provided the pilot works. But nothing would make us feel worse than if a Leo Gallo went to Jackson Square, ate an ice cream cone and died from it. We could have had these pens in there. And Councillor Clark asked a great question about the Good Samaritan Act and gross negligence. And I had a lawyer explain it to me this way as it relates to epinephrine auto-injectors. These things, I demonstrated at a previous public health meeting, you pull the cap off and it talks to you. Put up against thigh, counts from 5 to 0, and it's done. So a definition of gross negligence in the use of an epinephrine auto-injector would be, you give it to a person who didn't need it, you injected them in their eye, and it made them blind. And apart from that, the Good Samaritan Act covers you up, was how a lawyer explained it to me. I thought, well, that's pretty easy to understand then. And I think it's worth the risk, and this is about one thing, saving lives. It's that simple. Thank you.
Thanks, Councillor Whitehead. Are you speaking?
Well, I think there's just one piece that the other side, I'm not so, I mean, it's no different than we currently have the, what do you call them, the device, defibrillators in our rec centers and so forth. And certainly if that's used improperly, I mean, it'd be the same kind of exposure. And we certainly went forward in every rec center with that particular device. But the question for me is more not about the misuse of it, but the fact that you're entering into that realm. Security has the EpiPen. Somebody is in dire need. That security guard isn't available because he's tied up with something else at the particular time for whatever reason. The person dies knowing full well that there's a program there that made that pen available for these causes. In that situation, would there be exposure?
So through the mayor, I guess I would say this. There are a number of specific scenarios that are laid out in the confidential memo that talk about what exposure there may be under different circumstances. And I guess this is where my comfort level is not really there in having this discussion in open session, not because I'm suggesting that there's any greater risk, but it's really, these discussions are better enclosed.
Fair enough. I just, when you start building, and my concern is when you start building a program that people become to rely on and understand it's there, and it's not there when they're needed, then it would be logical that there be some form of exposure to whoever in charge of that particular program to some degree. That's a concern I have, because it's almost like we are now taking on that responsibility, and by reaching out and taking on that responsibility, now do we further expose ourselves if we don't deliver in a timely fashion in a situation where an individual has an attack and no one shows up with the pen in an area which was designated as part of the pilot program. That's my only concern. I think overall there's a greater public good being served here. No question about that. And that's why I second it, and that's why I support it. it's clear the move we made with the rec centers, lives have been saved. A number of lives have been saved as a result of having defibrillators in our rec centers. There's no question that when the need is there, and in these particular malls, that there's a lesser risk to individuals that may end up having an attack without having EpiPen with them than there is in malls that they don't exist at all. So I think it is a worthwhile program to pursue. And I certainly understand the ethics point. I went to 2 days ethic training on the children with autism and the benchmarking program. I had to spend 2 days going through a whole ethics process with health, Ministry of Health. So I understand the approach and some of the criteria and the matrix they utilize to arrive at decisions, sort of the checkpoints. And that's perhaps one of the reasons why MAC isn't there yet. But I'm confident it's a matter of checking off all those boxes. So I fully support what's here before us, and can't wait to see it implemented. Thanks.
Thank you, Councillor. Could you take the chair back, please? And I'd like to make some concluding remarks. I think the most important thing that Rotary has done is bring the awareness forward. And when you read the literature and when you look at issues of anaphylaxis death, it's generally related to the lack of awareness of the individual or the family to ensure that an EpiPen is on the person, the young person. And so I'm not sure in this sense why stating that 2 mall food courts are okay because there's EpiPens there and there's staff trained to use them, that it will make that much difference in terms of when you read of the 15 deaths that occurred in the last, I think since 2000, something like that. The issues around it were generally not the absence of an EpiPen. It was the lack of awareness of the individual. And so we need to bring the awareness up. And I'm pleased to, as the chair of the Board of Health of this city, work on awareness programs. But in terms of the specific issues of risk, because what we hear, through you, Mr. Chair, is misapplication of the EpiPen. If somebody sticks it in your eye or drops it on your foot, there could be many, many issues. Well, that's true. One of the issues is if the pen falls and sticks you in the foot, there are medical complications that occur from that. But the point is, there could be many other reasons why someone went to a food court, had anaphylaxis shock, succumbed, without reference to security guards or where the thing is or whether it was past the due date or was kept in a heated atmosphere that destroyed the integrity of the adrenaline. I mean, there's lots of little things that can go wrong. And whereas the Restaurant Association is saying, we'll put it on a voluntary basis. And are there other ways that we can contribute to the awareness program without signing on the dotted line that we are taking the risk? Sorry it's so funny, but I'll take the chair back and thank you.
Thank you. I have no other speakers, Mr. Chair, so.
Okay, on the motion, the recommendation is moved and seconded. All in favor? Any opposed? Hearing none, we'll move on. Item 8.4, any discussion regarding 8.4? Any discussion on the Board of Health self-evaluation results? Councillor Powers moves, seconded by Councillor Clark. All in favor? Carried. Thank you. Councillor Merulla, are we at motions now? Yep. We've done the 12.3. Okay. Councillor Merulla, you have an amendment to your motion. Would you like to introduce your motion as amended?
I will indeed. Thank you, Mr. Mayor. And it's moved by myself and seconded by Councillor Clark that item 9.1, Ottawa Street Mobile Farmers Market 2-year pilot program be amended as follows. A, that the words local food grant be replaced with the Ontario Ministry of Agriculture and Foods Local Food Fund in subsection A of the recommendation, and B, that the words through the city's tax stabilization reserve be replaced with the words from the Newalta Landfill Royalty Reserve created to fund projects for the benefit of the former City of Stoney Creek for up to $100,000, and the remainder be funded from the city's tax stabilization reserve to read as follows. A, that the Public Health Services assist the Ottawa Street BIA apply for funding from the Ontario Ministry of Agriculture and Foods Local Food Fund for the proposed 2-year pilot mobile farmers market project, and that any shortfall be funded from the Newalta Landfill Royalty Reserve created to fund projects for the benefit of the former City of Stoney Creek for up to $100,000, and that the remainder be funded from third-party sources. So I have an amendment to the amendment in that I would like to remove the city's tax stabilization reserve to read the third-party sources, which I don't think we'll need to tap into. And C, that the words beginning in 2015 be added to the end of subsection B of the recommendation to read as follows. B, that within the bylaw, food services vehicles, subsection 6, planning and economic development, explore options when funding is obtained to implement the 2-year pilot project on sites identified by planning and economic development and public health services beginning in 2015. D, that the following subsection C be inserted and that the subsequent subsection be relettered. C, that the sites include 2 locations in Stoney Creek to be determined. The final wording of the recommendation will read as follows. Therefore, be it resolved that the Public Health Services assist the Ottawa Street BIA apply for funding from the Ontario Ministry of Agriculture and Food Local Food Fund for the proposed 2-year pilot mobile farmers market project, and that any shortfall will be funded from the Newalta Landfill Royalty Reserve created to fund projects for the benefit of the former City of Stoney Creek for up to $100,000, and the remainder be funded from third-party sources. And B, that within the bylaw, food service vehicles, planning and economic development explore options when funded, which I already read that part. C, that sites include 2 locations, Stoney Creek, to be determined. And D, the public health services and planning economic development work in collaboration with the Ottawa Street BIA on the operation of the proposed 2-year pilot mobile farmers market. And if I just want to take an opportunity to firstly thank Council in the past for their support for the Ottawa Street BIA and the farmers market. It's quite remarkable. It seems like just yesterday that I was being petitioned about the farmers market at the Centre Mall, which was slated for closure or relocation as a result of the redevelopment of the Centre Mall. We're now seeing about $150 million redevelopment at the Centre Mall, and since then, after being petitioned, I'm very proud to have said, as a result of Council's support at that time, we were able to find a location on Ottawa Street. And since then, we've not only engaged in actually redeveloping the area from an infrastructure standpoint, but also we actually have an actual official zoning for that market, the only one of its kind in the city of Hamilton. And because of that, we have others that have sprung up as a result. But we really, truly, in Ward 4 or East Hamilton, with the Ottawa Street being shared with Ward 3, are pioneers in this development. Also, it'd be remiss of me not to mention Patty Hayes, who's the executive director and the board of the BIA, for their support, particularly when relocating the Ottawa Street Farmers Market. At that time, I went out on a whim, believing that it could work, and it did, but it only did because of the support of Council and because of the support of the BIA and people like Patty Hayes. I want to thank Dr. Tran, who has been incredibly thorough. I must say, if anybody around this table hasn't had an opportunity to work with Dr. Tran, I suggest you do, because he is very thorough and his expertise is beyond, just needs applauding. Also, what's interesting about this project, the synergies, that means I guess I've been speaking too long, but the synergies related to this particular project are quite timely and also very exciting, in that the McQuestion neighborhood in Ward 4, we're developing presently the largest urban farm locally. And in that development, we found synergies not only with the food banks in St. Matthews, but also the Victory Gardens initiative. But now, with this mobile market, there's another synergy that we're creating for the distribution of these goods, And also, Environment Hamilton might be playing a role as well. So the fact that we've been able to, from an operational standpoint, find so many synergies, and thank Councillor Clark as well for expanding this to the Stony Creek area and for the funding for obvious reasons. I think it goes a long way to basically focus in on the need. And the need is that we have some food deserts throughout this city. And as a direct result, this project will go a long way in trying to fill some of those gaps. And for that, I do want to commend Councillor Clark for recognizing it and for obviously allocating the funds accordingly. And lastly, just want to thank the Board of Health and for everyone's support. Thank you.
Thank you. So seconded by
Councillor Clark.
Councillor Clark, and I have a speakers list: Councillors Johnson, Powers, Clark, Whitehead, and Jackson. Councillor Johnson.
Thank you, Mr. Mayor, and I just want to acknowledge that Patty is with us today up in the audience. I've had the privilege of working with Patty in my former life, and I've often said to people, if you ever want to see how a real good BIA works, go to Patty and see how she's doing things. So hungry. The farmers market, you've literally revamped this street with your help and your integrity, just your enthusiasm and getting things done, and nothing's ever a problem. That's the one thing that just I just find you so appealing, is that when we come with a problem, you're there to find the solution and not say, well, I can't do it. And you're always willing to do it. So I'm pleased to support this. It's just ironic that we've got a farmers market going from the urban out to the suburbans. But anyways, it's going to be quite interesting, and I'm really anxious to see how this turns out. Thank you.
Thanks, Councillor. Councillor Powers.
Through you to Councillor Merulla, just to be comfortable with this, is the introduction of this program into the various areas in the city will be by invitation, not by intrusion?
That's correct.
Okay.
All right. Councillor Clark.
Thank you, Mr. Mayor. In Stony Creek, we were looking for a farmer's market for a little over 2.5 years. And we touched base with numerous farmers and reached out, and the BIA actually had it on their agenda for a couple of years, trying to find vendors to support a farmer's market. Not an easy task to start from scratch, not at all. And we ended up finding that the farmers in the community were stretched pretty thin. And that was not an excuse, but a legitimate reason why they did not want to take on another farmer's market. And so the challenge became for us in Stony Creek, in Upper Stony Creek, 1 in 5 residents are living underneath the LICO, the poverty line. And in Lower Stony Creek, the numbers are similar. And we have a number of seniors on fixed income that don't drive, so if they don't have someone taking them to supermarket, they may not be getting the fresh fruits and vegetables that they otherwise would. We also looked at the farmers market as a gathering spot for the community, encouraging people to walk to the farmers market. And many of us can remember, well, maybe not many of us, but a few of us can remember farmers markets when we were a kid, walking to the farmers market. And they would be at different locations across the city, and they magically appear, and people would be starting to get their produce there. So in Upper Stony Creek, it is there's a couple of areas. Valley Park, it's an excellent location. There's a couple of churches that have expressed interest in farmers markets, and so we don't think we'll have any difficulty finding the location in Upper Stony Creek. In Lower Stony Creek, Councillor Pearson and I and Councillor Johnson, we talked a number of times, as did the BIA. There is room in Lower Stony Creek, just south of King Street off Lake, and room for a farmer's market there. So utilizing the money from the royalties for the landfill, which was a significant nuisance to the community, to bring a farmer's market into the community makes eminent sense to the community. I want to thank the Ottawa Street BIA for the idea. I want to thank Councillor Merulla for the support, and the councillors around the table, because this really does provide a service to the community in my ward and even in Councillor Pearson's ward because of the proximity that we don't have currently. And I just really think it's a very positive outcome. And I know the Stony Creek BIA wish they could have done it on their own. That wasn't possible. But they're pleased to have the funding in place to have that gathering spot and hopefully improve their lot at the BIA also. So this is a very, very positive, synergistic announcement. So again, thanks to all.
Thank you, Councillor. Councillor Whitehead, then Councillor Jackson.
Thank you. Well, certainly the concept I'm quite pleased with, and the funding makes it even more pleased with. The question I have, though, and I need to ask this, is the BIA falls under a legislative requirement. They have a defined boundary in regards to the area they serve. In this report, it suggests that I thought the farmer market at Ottawa was making the application for the agricultural funds. In this report, or this motion, it says the BIA is applying for it. So can I get clarity on?
Mr. Mayor, I can answer that. Clearly, you're absolutely correct with respect to the BIA scenario. However, we do have a separate governing body for the farmers market, and I was remiss in not thanking Councillor Pursuta for his involvement in that particular group. So my apologies for that, Councillor Pursuta. He's been incredible, not only on the farmers market in Ottawa Street, but also in the Question Garden as well, which his expertise has been great. Having said that, so the BIA is facilitating it, but the entity that owns the mobile truck is the actual farmers market and not the BIA. So the benefit goes to the farmers market and not the BIA.
So on the legal papers for the granting fund, who's making the applications? The Ottawa BIA?
The BIA is working on behalf of, as an administrative role on behalf of the farmers market.
Well, if that's legal, and that's fine. I just want to make sure that we're not getting in a situation that we're. Well, that's why I'm asking legal.
John Hawker, do you have a law degree? Okay, so I was going to ask you. So we have our legal opinion. You want to ask that question again, Councillor?
Yeah, I'm just curious as to who would be the formal entity that oversees the funding, the application on this particular pilot program, because in the motion it identifies Ottawa BIA. And of course, they have a legislative geographic area that they're responsible to. I've been told that it's a separate entity, so I just need some clarification. What entity is actually making the application? And which one would be, if it's the Ottawa BIA, could they legally do with that, understanding that they'd be outside their own legislative responsibility?
Through the mayor, I apologize. I don't have an answer off the top of my head for that. I would have to take a look at that. I understand the territorial limitations of a BIA generally, but I'd have to take a close look to see really the answer to that question.
This won't be ratified until council, but I can assure you that the Ottawa Street BIA is playing an administrative role on behalf of the actual farmers market itself. It's not rocket science. So by Wednesday, we'll have all the information pertaining to this issue, and will be sent to all of Council or Board of Health accordingly.
Okay, so Councillor, then if there's any lack of clarity by then, you can raise it again.
If there's a separate entity which they've described who are making the applications and are overseeing the particular program, Mr. Mayor, there's no issue at all. When you get into BIAs making applications for money funded but money programs, and they're going into communities beyond the scope of their mandate, it does create a bit of a conflict, and it does create a problem with the legislation and what the legislation defines what the BIA is responsible for. So I want to make sure that this is a clear delineation between what is legislated regarding the Ottawa BIA and what is an independent organization.
Have Councillor Jackson next.
Yeah, Mr. Mayor, thank you. Councillor Powers, on behalf of myself and Councillor Duval asked the question. I'm satisfied with Councillor Merulla's response. With Concession Street, we have a low farmers market that's located at the Sacred Heart Church parking lot, and just want to make sure Councillor Merulla's provided the assurance that this mobile farmers market will be on invitation only into other business areas. So I'm supportive of that with that condition.
Okay.
Thanks, Mr. Mayor.
And Councillor Clark for a second time.
I appreciate the Ward 8 councillors' concerns about the legislation with regards to the BIA, but there are numerous ways to work this process so that everybody wins in the end. And that's the intent. It's not to subvert or go around legislation. It's to work with the legislation and enable a farmer's market to go into a community that couldn't, well, first off, the Stony Creek BIA does not have the money for a farmer's market. And so this actually helps us do it in two different locations. If there are concerns, we can work through the process with legal, but I can assure you that if there is a independent third party that is actually running the farmer's market, and it's just the BIA that's administering the city's funds to them to make sure that it's properly serviced and meeting all the bylaws, it's a legitimate process that we've done many, many times in the city. So I hope this isn't going to be held up when it's actually a good news announcement on a protocol issue.
Well, thank you. As the chair, I would say that I would be interested in hearing the remarks regarding clarification of that. I appreciate that, and I'm sure that the matter is going to go forward in a positive way, but I would like to get the information back.
Mr. Chair, and I'm only raising it not to get in the way of it. In fact, I think I opened my comments and I said it was a great concept and we've identified an area of need. My concern is the slippery slope. I do chair an advisory committee with many BIAs, and I've heard from other BIAs in respect to embarking on programs beyond their boundaries and responsibilities. So clearly there would raise a ripple effect. I just want to ensure that what program we're embarking on is independent of the BIA.
Okay, I think we're in a good place on this one now. So all in favor? Carried. Thank you. We'll anticipate hearing something prior to council. Notice of motion. Councillor Collins, would you like to introduce your notice?
I would, sir. I'm not certain whether there's an opportunity to move this forward today. I'd certainly, if there is an appetite to do that, I would move to waive the rules. If people need more time to ask staff questions or questions of myself, I'd certainly be willing to hold off on that. So,
So, Councillor, on a request to waive the rules, is that what you're going to speak to? Go ahead. Oh, yeah, okay. So, moved, Johnson, seconded, all in favor. As Johnson waited to waive the rules, please go ahead with your motion, Councillor.
Thanks, Mr. Mayor. And it's fairly self-evident. I will skip the whereases, which provide reasons and rationale as to why the motion is in front of us today. But I do want to speak to the issue of certainly the stations and the history in the East End. And as Council knows, we funded a pilot program, a pilot project, sorry, in the East End of Hamilton that seeks to reinstated an air monitoring station at Sam Manson Park. And as you are probably well aware, up until the mid to late 1990s, we had an air monitoring station at this location funded by the provincial government. And it was under the Harris years that, in fact, we lost that station. And at the time, it was their environmental critic for the Liberal Party was a Mr. Dalton McGuinty, who criticized the government of the day for removing the station, talked about the benefits certainly that station had for the east end of Hamilton, with all the industry that we have. And but the government still went ahead with their cut, and it was just a couple of years later that Mr. McGuinty's government was elected to office, and I sent him correspondence reminding him of his comments when he was environment critic. And unfortunately, I received a letter from the then minister. I can't recall who it was at the time because the environment minister has changed hands several times. But essentially, the Ministry of the Environment stated that they were comfortable with the position that Hamilton was in with the 3 other air stations that we had in the city, and were not going to reinstate the funding, which was a disappointment to the then Board of Health and our council. And so fast forward several years later, we found ourselves in a position where we're going through this pilot program, and we know all the good reasons as to why we supported the pilot. Certainly we have the juxtaposition of residential homes next to industrial operations. We know what kind of baggage comes with Hamilton Industrial East End and our North End. And so we also know that over the last 100 years we've developed that industrial North End with very few standards. We do not see the same type of standards in the industrial North End or East End that we see in our modern business parks, where today you will find in that area piles of scrap, piles of raw material, lots of heavy truck traffic. Many of these properties are not paved, and so there's a lot of dust migration. And then, of course, we have the stacks that come with some of these industries and the associated fallout. And we know that with the current statistics that have been presented to our Board of Health and our Council, that almost 190 Hamilton residents are dying prematurely every year, with the contributing factor to poor air quality in our community. So the culmination of all of these issues, Mr. Mayor, has led to certainly a number of requests from the people that I represent in my area, who are constantly asking for the reinstatement of that station, who are looking for more information rather than less. And this motion seeks to accomplish that. Of course, it will be funded through the area rating. The operational dollars as well will be funded in the first year through the area rating. And then this council will have a decision to make during the budget process of 2015 as to where we go with this on a go-forward basis. And it's, in the grand scheme of things, it's certainly not a lot of money. The stations are going to help us with not just the QEW and the Red Hill traffic that I mentioned in my interview with the media, but you know, today's Sherman incinerator debate is yesterday's Liberty Energy, and for those of us who represent the lower city, or even some of those on the mountain who have industry, and we recall the Maple Leaf debate from years ago, there's a revolving door of applications that come in from industrial operations that from time to time raise the interest of the community and the concerns related to air quality. And so these stations, they are mobile, can be moved around the city. They can be certainly moved to areas outside of Ward 5. The proposal right now is to service the parks that are listed in the recommendation. But essentially these can be moved into other areas. And so if we have the Sherman incinerator issue, as Councillor Morrow and his community are dealing with, or some of the other issues that we've dealt with across the city from an environmental perspective, these stations can be moved to other locations to garner and gather information that will help us to deal with hotspots, those hotspots that we would highlight in the industrial areas or along major transportation corridors. And so that's the basis of the motion. I want to thank Matt Lawson, Mike Bush, and Rob Hall, who've met with me to get us to where we are today with this motion, and all the residents who have called in support, not just since this was announced, but those who have over the years reminded the city that there's an area within our community that has heavy industry, and there's a real void as it relates to monitoring. So those are my comments, and I'd be happy to answer any questions at this point in time.
Okay, so Further speakers, Councillor Pearson, Councillor Johnson. Pearson.
Thank you, Mr. Mayor, and I want to thank Councillor Collins. This is a great initiative, and certainly I'm pleased to hear that they are movable, so they can be put in strategic areas. But I just want to be sure on the listing that Councillor Collins has for item B, that staff investigate several other locations. I'm assuming one of these is close to the Red Hill, through you, Mr. Mayor, and maybe to the good councillor, because I think that was one of the concerns he was asking, that an area near the Red Hill be included.
Yeah, I've identified 2 parks, one on either side of the parkway. So one is Glencastle Park, which is just off Mount Albion, and the other one would be in the vicinity of Rosedale Arena.
Thank you, Councillor Johnson.
Yeah, thank you, and I want to thank Councillor Collins for doing this. And in my former life, I think this was one of the voids that we were trying to seek to fill, and I think this is a part of it. Through you, Mr. Mayor, to the good councillor, we keep talking about downloading, and we keep talking about how the provincial government is adding a lot of stressors to us. At the bottom, or at the end of the day, for next year, instead of it going through the capital project or along with the capital project. Sorry. But I have the microphone.
Can you get that again?
What I'd like to ask you is there anywhere in this motion where we can add something that we also actively seek the MOE for some of their support, funding or otherwise, so that next year when it does come to the capital project that we're all anxious to include this, it's just one more form of downloading if we don't go after them and say, we're doing your job for you, we've started it, help us out.
Absolutely, I'd be happy to add that as a friendly amendment to the motion. We have made asks before, but there's an election on the horizon, so maybe the answers will be different this time around.
Well, maybe they will. Thank you. And the other question I have to you as well, one of the benefits of having some of the air quality monitors that are in the North End right now, there's real time, and it goes on to the website. And Rotec is awesome for this, Dennis Core and the group. Is this also going to be added to that internet?
It would be, and that's where the operating costs come in. There is a cost to not just monitor them, but post them online, and so there's a contractual cost that would come with this, with Rotec and their partners and stakeholders. So this would be incorporated into the existing information that's currently provided online in real time.
And thank you for that. The last thing, and it's just more of a comment, I'm really anxious to do a lot more work in the Jones and Arvin area, and that's in my area. And I think when Rotec comes forward with clean air, they actually highlight that area as being the #1 polluter of the entire city, not the north end of Hamilton like we all seem to think. So this is one of those things that for next year I'd like to see, if we do pass this through the 2015 budget, or the current council does, that Jones and Arvin becomes an earmark for this, because I think it's fabulous, and I want to thank Councillor Collins again. This is a great initiative, and I fully support it.
Thank you. I have Councillor Merulla, then Councillor Clark.
Thank you, Mr. Mayor. Let me first commend Councillor Collins for this initiative. And I also want to acknowledge that what Councillor Johnson did state is very accurate. As you know, I'm forever discussing roles and downloading issues and jurisdiction and who should be paying for what. There comes a time and we find ourselves faced with a number of challenges on a regular basis. I can recall off the top of my head, home care as being one of them. When the province came down and cut us off at the knees, we basically came to the plate and we made the difference, because we weren't prepared to allow the province to basically victimize seniors in this town. And what happened was, as a result of public pressure, we were able to carry that program on temporarily until the province came forward and uploaded what deservingly should be at the provincial level. So I see this initiative no different. I see that fact that we've been fighting for air monitoring stations in the East End since 1995. I remember that because I was an employee of Dominic Agostino at that time, working at Queen's Park, and I can recall when Mike Harris made this announcement, and it was in June or July of 1995. And Sam Manson was one of them. They had along Lawrence Avenue, St. Christopher's Park. So it's been a long, long time since this decision has been made. And they've had a number of resolutions from this council accordingly to no avail. And in saying that, I think it's important that we do this, because one thing that we're known for is to pick up the slack, even when even though it's not within our jurisdiction. But I'm also glad that we're going to acknowledge that it's not within our jurisdiction and we're going over and above our jurisdiction to make a difference. But hopefully it's for temporary measures as opposed to permanent measures. And I look forward to the province stepping up to the plate and doing the right thing and uploading this particular issue with the existing, or with new air monitoring stations in East Hamilton and beyond. And I appreciate your time. Thank you.
Thank you, Councillor Clark.
I just wanted to confirm that the data will be public in real time. Is that what I think I heard Councillor Collins say that? So the Nuwalta Community Liaison Committee that Councillor Johnson and I sit on, they had also recommended air monitoring up in their community by the landfill. We already have air monitoring on the landfill, but there's an awful lot of pollution, dust that's coming in off-site, and so there's this ongoing concern. And I really believe the only way that we're ever going to convince the provincial government to start to pick up the slack is if we actually start to show the data, and that this has to be maintained on an ongoing basis, not during a 4-year term of a council, but on an ongoing basis provincially, so that everyone has it at the province. The budget deficit argument that has gone on for quite some time now seems no longer to hold true when there are special projects that the government wants to fund. But when there's things that municipalities want them to fund, they don't always jump on the bandwagon. So I think it's really important that we show leadership on it. And I think we'll find that there will be other areas in the city where we need to do air monitoring to get that background study before changes in the industrial areas start to happen, so that at least you can now assess what the impact is. If you don't have the background, it all becomes part of the ambient air quality, and that doesn't help anybody.
Thank you. Councillor Pasuta, could you take the chair, please? Deputy Mayor. The question of the airshed of Hamilton has always been critical, and I applaud the councillor for coming forward with the replacement of those air monitoring stations. That was the most ridiculous place in Canada to remove air monitoring stations. But it's important to know how much progress has been made and how much better the air is. Our air is, in fact, better than Pittsburgh's, and Pittsburgh has no steel mills anymore. In fact, it's diminished to us about 350,000 people. And so we've had some progress in the question of air quality, which in our case is most severely affected by hot summer days when the Ohio coal-fired furnaces fire up and all that stuff blows over here. So we've got to get working on the Americans too to get off the coal as we have done in Ontario. But it's interesting to know, the Boston Marathon was on yesterday, and I ran 50 miles a week for years and ran a couple of Bostons and tried to learn everything I could about healthy running. And one of the things I learned was that when you exercise, you ingest 12 times the amount of air as a sedentary or walking person. And so the advice was not to run in heavy, typically you're on business in a hotel downtown somewhere, and then you put on the togs and you go running around the city, and that's not good. And so we just had recently, the University of Ottawa did some very good study on cycling. And so now we're putting cycling lanes on Cannon Street. But I'm going to ask Dr. Richardson if she's aware of the study that Dr. Richardson, I have a question for you. Whether you're aware of the study from the University of Ottawa Environment Canada that suggests that cycling be done on secondary streets away from heavily traveled areas. Is that literature out there now?
Mr. Deputy Mayor, you'd raised this with me just before I had gone off on vacation, and this is one of the things that they've been looking at with cycling and different modes of transportation is balancing all of the different impacts. Of course, if you can bring down the amount of other traffic that's on the road. It improves the air quality. And so the more cyclists you have and the less traffic, the better it would be. But I was just saying to Dr. Tran as you were speaking that this is something that we'll need to look at as we move forward in looking at issues around transportation and multimodal transportation, is how do you balance those things together. And so I was going to ask Dr. Tran if he and Ms. Pizzetta could look into this a little bit further.
I'd appreciate that, and an informal report later on, because how it relates to this is that, and thankfully these are portable monitors, because then we can look at bike lane areas. We know now one of the worst places for ingestion of polluted air is at schools when the parents are dropping the kids off. And we've seen those giant graphs as all the cars are idling there, and those kids are walking through that. Now, what the long-term effects are, it's not for us to argue today, but I think it is important that we show more concern for the airshed, and that these monitors do come back, and that we further examine all of the air ingestion impacts of all parts of the city, but it could well be in South Mountain and different places. Look at the traffic jams they have in Binbrook now in the morning, and not too far away from school areas. That these portable facilities will be real assets to the continuing improvement of our airshed. So those are my comments. I'll take the chair back, and we have the motion. Go ahead, Councillor Whitehead.
I certainly support before us. I recall the issue of benchmarking and understanding what the airshed is and how it changes. And it can change from day to day, from month to month, from season to season. And all those areas and issues have impacts. And the fact that this particular air monitor system can be mobile and be utilized in strategic areas as defined by whatever policies we're pursuing, I think it's a wonderful idea and a timely idea, and that's why I'm supporting it.
Very good. Any further comments? So on the motion, all in favor? None opposed? Thank you very much, Councillor.
Notice of motion.
Big step forward. Notice of motion.
Yeah, I will move at a future meeting, Mr. Mayor, the position to go against the gasification process operation proposed for Sherman and Burlington Streets. It's been public discussion lately, and I will have more information in advance of the next meeting.
Okay, so
thank you.
Clerks will have to kind of make a sentence.
Through you, Mr. Mayor, we respectfully request that any notice of motion before the Board of Health be in writing so that all members.
I can't hear what.
Okay, the request was that the notice be placed in writing so that all members of council. Can you cobble that together on your word processor? Okay, thank you. Councillor, no, any other notices? That's it. So general information, revised due dates on the outstanding business list. Councillor Pearson moves, seconded by Johnson. Items 11.1 and 2. Motion to remove items 11, 2, 3 to 5 from the outstanding business list on 11.2. Johnson and Pearson, all in favor? Thank you. Powers moves 11.3, seconded by Pasuta, all in favor. Private and confidential. Move to receive the 2 reports in open session, all in favor. That's carried. And on the personnel matter, 12.3. We now have a private and confidential matter before us. A motion, please, to go into closed section pursuant to subsection 8.1f of the city's procedural bylaw and section 239.2 of the Municipal Act as the subject matter pertains to personnel matters about identifiable individuals, including municipal or local board employees. I would request that all members of the public and media vacate the chamber for the duration of the in-camera session, and please take your belongings with you. All are invited to return to the chamber once the committee reconvenes in open session. I would ask that any members of staff who are not required to be here for this matter also vacate the chamber. Once the committee is reconvened, we will continue to deal with the items on the agenda. Motion to Clark, Johnson, all in favor? Carried. We're now in closed session.